This video will demonstrate ordering medications for future encounters. This video will demonstrate how to order a statewide power plan for a future planned visit. Please note that ordering unit-specific power plans require a slightly different workflow, and please refer to QRGs or adoption services on 8800. In this video, I'll use the scenario of a pediatric patient having future medications ordered in the pre-admission clinic. However, the steps that you will see in this video are applicable to all patients in all clinics. Power plans cross encounters, which means that you can plan them in any encounter and they'll be visible in future encounters. For this demonstration, I'll be using the general surgery power plan. Local business plans may recommend renaming the power plan to align with the required procedure in case the patient is booked for multiple procedures to help identify which power plan should be initiated. Please refer to local business rules and procedures around the titling of the power plan. Our patient has presented to the pre-admission clinic and I want to prescribe medications for the day of surgery. So I'll order the general surgery power plan. You can see that this is a multi-phase power plan. We have a pre-op phase and a post-op phase. I will select the pre-op phase. It is important to deselect any of the pre-ticked orders that are not required, particularly the patient care tasks which the nurses would select if they were required on the day of surgery. So I will untick those here. Make sure that you are clicked on the phase in which you want to prescribe, and then click the Add to Phase button. We'll click on Add Order. For the purpose of this video, I have saved my medications into a favourite folder to speed up the ordering process. You can add any special instructions into the order, such as the type of surgery, for easy identification for the nursing staff on the day of surgery. So in this example here for the EMLA cream, I have written in the special instructions to apply to skin 30 minutes prior to peripheral IV insertion. It is also important not to change the order date and time. The orders will be available at the time of initiating the power plan. You can also add investigations to a power plan as well by clicking on Add to Phase. It's very important that you click Plan for Later and not Initiate Now. Plan for Later means that you're planning these medications to be given later in a future encounter. When the patient represents on the day for surgery, the nurse will navigate back to this power plan and then they will click on the appropriate phase and then they will click Initiate. Once they click Initiate Now, all orders will become active, including medications for administration on the MAR. It is important to note that all pre-medications for that surgery are added to the same GenSurg power plan. If you require more help or assistance with cross-encounter power plans, please search Metro South Digital for resources or call the Adoption Services team on extension 8800 or 3176 8800 if dialing externally.